This is a hearing of the Appropriations Subcommittee for Labor, Health, Human Services, and Education. And this is a hearing in a long line of hearings where we focus on particularly distressing ailments. Today, as you know, it's muscular dystrophy. At other times, we have special hearings on amyotrophic lateral sclerosis, on Alzheimer's, on cancer, on Parkinson's, and we do this at the request of the various groups. Today, the hearing has been scheduled at the specific request of the Parent Project Muscular Dystrophy as part of their first annual legislative conference. Approximately 110 Parent Project Muscular Dystrophy parents are going to participate in the conference, and there are 20 young entertainers participating in the Kids for Kids project to focus on this particularly disabling childhood ailment.
Maybe I'll try to build on, Mr. Chairman, a question or really a comment on your part to Dr. Sweeney. Dr. Sweeney, in terms of, you had talked about DMD, and until, I guess it was Sherry Gunvalson from Minnesota who's here. I know there are a number of people, Eric, you're here as well. Until I met Sherry a couple of years ago, I just really had so little knowledge. And has part of the problem been, there certainly has been the appropriation, has part of the problem been that the invisibility of muscular dystrophy, at least as it affects children, and that there's been such a small number of families that have been affected in the whole country that there just hasn't been the presence and the clout or the focus to get the research, or is it something else going on here?
Well, I think it's a number of factors, and I think there's good visibility. I mean, the MDA has for a number of years raised the visibility of the muscular dystrophies in this country. Mm-hmm. I really think that the problem I perceive, and I guess we can debate whether there's a problem within IH is really not a lack of interest on the part of the institutes, but it's
no,
more.
I don't think there's lack
it's
of
more of a problem, as I said, in sort of the way these grants get reviewed. Mm-hmm. I mean, the vagaries of the review process at NIH, in large part, dictate what sort of work gets funded. Study sections get set up that focus on a certain area. There's not a good home to review grants that deal with the muscular dystrophies. And because of this, I think they're chronically underfunded, and because of that, new investigators are discouraged from going into the area. And this was brought home. I went to a workshop that NIAMS held a few weeks ago, a very small one, where we were talking about better diagnostics that could be used in the skeletal muscular dystrophies. And all the technology that we were talking about had originally been developed in skeletal muscle and now is being used in the heart. And when the experts were asked, well, why isn't it being used in skeletal muscle for those diseases? They said, well, there was no funding, and so we went to work on heart. So, I mean, it's a perception in the community. And, you know, where there's a perception, that there needs it needs to be addressed.
Dr. Cherish, you comment about we now have all the information and it's time for an action plan, a task force. We didn't just get all the information this morning. How long have we had it?
Well, you know, we've explored a number of, we started the first human trial, but for safety alone, and we chose adults. And if it works in an adult,
Dr. Cherish, the point I'm making is, why have we languished? How long have we had the information which would warrant an action plan and haven't done it?
Well, we've had it for a year and a half, and we started on the first. It's cost us $5 million just for the first trial on safety alone. If we're going to expand that to efficacy, it's going to be a fortune, and it overwhelms.
You know how many $5 million there are in $1.4 billion? We turn now to Ms. Patricia Furlong, president of the Parent Project Muscular Dystrophy, mother of 4 children. 2 of her daughters are with her today. Regrettably, both of her sons died of muscular dystrophy. She's a nurse practitioner and a nurse educator. She served as chair for Kids Project. And we welcome you here, Ms. Furlong, and look forward to your testimony.
Thank you, Senator Spector. It's an honor to be here today. Parent Project Muscular Dystrophy would like to thank you, Senator Spector, Senator Craig, and Senator Wellstone for being here, and Betty Lou Taylor and members of this committee for this opportunity. We are indeed honored that voices are heard here in this city and in this place. I represent the Parent Project Muscular Dystrophy. It's a nonprofit voluntary health organization comprised of parents and grandparents whose children are diagnosed with Duchenne and Becker muscular dystrophy. Our goal was to add in the options to expedite therapies for Duchenne muscular dystrophy. Mr. Chairman, today I ask the members to focus on Duchenne muscular dystrophy. For years, we have been witness to the public information that we're almost there, we're around the corner. Answers are on the horizon, but are they? Mr. Chairman, we're not there. Although there are emerging strategies leading to therapy and treatment in the future, the NIH investment has been minimal. On a sunny day in June 1984, my sons were diagnosed with Duchenne muscular dystrophy. To this moment, I recall those words. Mrs. Furlong, your sons have Duchenne muscular dystrophy. There is no hope and no help. The prognosis is the same. It has been the same. They may not survive. The physician then asked me if I had any questions. I wondered why the sun was shining. I asked him that. My personal story has to be more than this. It has to be a collective story about all boys diagnosed with Duchenne and Becker muscular dystrophy, and following their exposure to medical intervention, losing all independence. Mr. Chairman, there's nothing that has changed in 100 years. Nothing will change without increased investment in Duchenne research. One day long ago, my son Patrick was trying to convince me of a crazy argument he had. He said to me, "Mom, pretend I'm in a midlife crisis." In fact, he was. He was 8. Duchenne, the most common lethal genetic disorder of childhood, has not had sufficient attention, and the ordinary person has no recognition of this disorder. And yet, due to the high spontaneous mutation rate, every person is at risk. The clinical explanation does not clearly reflect this disorder. By the age of 12, most boys have lost their ability to walk. The child needs help with ordinary things, turning in bed, lifting a fork, wrapping their arms around someone they love. By the age of 17, breathing is sometimes difficult. Often invasive ventilation is necessary. During the late teens or early 20s, young men with DMD are unable to manage oral secretions and often have to have stool removed because they are unable to do it themselves. Remember, muscle is not just for moving bones. The diagnosis of Duchenne is accompanied by a lifetime of progressive loss of function, loss of independence, and dependence on family. It is an extraordinary physical, mental, psychological, spiritual, and financial burden to the family for all of us as a society. Finally, the loss of these boys. Their absence diminishes us and the greatness of this country. Before his death, my son Christopher said to me, "If you will not fight for me, who will?" It is for this reason we started the Parent Project Muscular Dystrophy. Beginning in 1997, the Parent Project Muscular Dystrophy members successfully initiated a legislative agenda. We began with a grassroots fundraising campaign. We began meeting with members of Congress, members of the Senate. We began talking about Duchenne muscular dystrophy here on the Hill. Last year, we with your kindness, saw the first title in the Children's Health Act. This was the first time in history a federal mandate for DMD was initiated. This year on Valentine's Day, H.R. 717, the DMD Care Act, was introduced in the House by Representatives Wicker and Peterson with an unprecedented 92 co-sponsors. Parent Project Muscular Dystrophy has established extensive collaborations with the NIH and the Center for Disease Control, but without adequate funding of these efforts, they will fall by the wayside, and another generation of children will see no change in prognosis. Mr. Chairman, Congress is very generous to NIH, but this disease, the #1 lethal genetic disease of childhood, gets only 1/1000th of the NIH budget. No wonder there is nothing available for these children. Our children are not out of their warranty period before their bodies wear out. They will never receive adult status to advocate on their own behalf. This generation, this disease sends ripples of pain and dysfunction through every family. On behalf of the children with Duchenne and Becker muscular dystrophy and their families, and all of these people you see here with muscular dystrophies, we ask the federal government to commit $100 million over 5 years specifically for Duchenne research. This would change the face of this disease forever and jumpstart an important field of research. Today, we're not seeking exceptional funding for our children. We seek equity. Respected members of this Congress, our battle is against Duchenne and Becker muscular dystrophy. We seek equity, equity in research opportunities, equity in set-aside funding, equity in the review process, equity in worth, the worth of every child with Duchenne and Becker muscular dystrophy, the worth of every person with muscular dystrophy. Mr. Chairman, it's too late for my own sons, but with your help, this disease will change. Thank you.
Mrs. Furlong, for that very moving testimony. We're heartsick to know of the death of 2 sons. It's a tragic loss. My wife and I have 2 sons. Fortunately for us, they're healthy and still with us, but we have some understanding of your grief, and we admire the work you're doing to try to change things for other people's sons.
Mr. Chairman, with your indulgence, may I take 1 minute to just make one quick comment? I wanted Ms. Furlong to know I brought the language here that really, I first of all couldn't agree more with what the chairman said to you, but I do want you to know that in a small incremental way, I mean, your work has really made a difference. That children's health care bill, I had something to do with working on that legislation, and it was because of you all that we were able to get the language in that called for a coordinated approach on Duchenne disease, and I think the first appropriation was just $5 million this January, but it was a start. But before your voice and before all the work that all of you have done, there hasn't been that kind of coordination and focus, and so I just want to make it crystal clear this is just the beginning of this journey, but the work that you and everyone else in this room has done has been terribly important, very, very important. Thank you for your very strong, passionate, wonderful voice.
Thank you, Senator Wellstone.
Thank you, Senator Wellstone.
Ms. Furlong, H.R. 717, if it were to become law, would authorize 3 centers of excellence for DMD research at the NIH, and it authorizes 3 centers of excellence for DMD data collection, surveillance, epidemiology. Would you give us a little of the background of your involvement in why the legislation was structured as it was, and do you believe it fills the needs that we currently understand or you currently understand are there?